So in this video, it's slightly older. It is from early May, but I think it's important. It's one I should have covered a while ago, but I didn't. Self-harm and suicides among healthcare workers rising, warns MP. So here we have MP Dr. Khan um, talking here, but yeah, we'll go through the article. Coronavirus is like to have devastating consequences on the health and social care workforce. There's been a clear rise in the number of suicide, self-harm, and suicidal ideation among frontline care workers, claims Shadow Health Minister Dr. Khan. Dr. Khan, a practicing A&E doctor and Shadow Health Minister, has called for urgent intervention amid a rise in the number of health and social care staff experiencing serious mental health issues. Experts have previously warned that COVID-19 is like to have devastating consequences on the health and social care workforce. That's not a huge surprise, purely because of the fact that healthcare workers are typically understaffed, need massive amounts of help, weren't given the PPE, weren't given enough advice, and this is what's happened. And I have every respect for healthcare workers, and I hope that they get the help that they need desperately. And so, writing to Matt Hancock, the Secretary of State of the Shadow, writing to the that doesn't make sense. Writing to Matt Hancock, the Dr. Khan said so. Writing to Matt Hancock, Dr. Khan said, as I speak to my colleagues across the country and in our unions, it is clear that there's a rise in suicide, self-harm and suicidal ideation among frontline NHS and care staff. It is vital to tackle this. There is real-time data to understand where particular pinch points may be and where resources may need to be directed. Dr. Khan calls subsequently upon Matt Hancock to ensure that measures are in place to track and monitor issues as much as needed, and support for frontline staff. Adding the need for therapists is more important than ever. I understand that the NHS practitioner health scheme, which offers face-to-face support for doctors and dentists, is widely valued. Would the government support extending the service to NHS frontline workers and care staff during the crisis? Our frontline NHS staff are doing fantastic work in extremely difficult circumstances. Yes, they are, absolutely. Unless our staff are safe, they cannot keep us healthy. Dr. Khan also calls for post-traumatic stress disorder PTSD support, noting that PTSD could present months or even years after, could be present months or years after COVID-19, which absolutely I agree with. And we jump to this article. This is from American healthcare workers, but the same could be said for UK workers. I couldn't find anything about UK workers specifically, but we can easily make the jump from one country to another purely because of how badly COVID-19 was dealt with by both countries. So for many frontline workers in New York, the past few months have felt like a war. On the darkest days of the coronavirus outbreak, 1,000 people were dying here every 24 hours. Refrigerated trucks appeared outside hospitals to be used as temporary morgues. The city became the epicenter of the global outbreak. Today, there is a break in the clouds due to social distancing and quarantine measures. The number of deaths is down fewer than 200 a day. I think that's only in this state specifically. But as chaos abates in the emergency rooms and intensive care units, nurses and doctors are preparing for an entirely new fight. Experts are now warning of a mental health crisis for medical workers who have spent the past month on the front lines of the pandemic. And so we can see from this article is the fact that healthcare workers are struggling here. And they've encountered other crises, SARS and Ebola, but in other ways, COVID-19 is forcing us to navigate some uncharted territory. It's the fact that these Ebola and SARS didn't hit the West as hard as COVID-19 has. SARS had a massive impact on Far East Asia countries, and Ebola was, I think, mainly constrained in Africa. Which is lucky because that's another virus which is incredibly deadly. And so we can see that healthcare workers, both here and across the pond, are fearing for themselves mental health wise, purely because I can't imagine how stressful it is to be the person who has to comfort someone into death, essentially, because a lot of these healthcare workers would have seen a lot of people die. And so I hope they get all the help they need to get through this. And so we jump to our final article, which is this is pre-pandemic, so this is in November. So it's NHS workers being hollowed out by registered nurse shortage. So we can see here that, as mentioned before, that there's a massive nurse shortage within the UK, and that there was a massive crisis with nurses pre-pandemic, and they were understaffed, and they often went into shifts without enough staff to deal with just the normal day-to-day stuff. So you got to imagine in a pandemic where you had hundreds of people dying, especially early on, how the impact it would have had on medical workers who were understaffed already, and to put it shortly, but the country has failed them. The country's failed our healthcare workers, and we can talk about how great the NHS is and how much we care, but in the end, we didn't care enough to support them properly. And so I hope going forward that the government commits to reform and investment within the NHS, making sure they have enough staff, making sure that there's enough mental health workers to deal with NHS staff to help them, because we need them desperately and they need us to help them. And there's massive mental health problems within the UK as is. There aren't enough mental health workers already, and so I fear that these medical professionals won't get the help they need. And so look, I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.